In this video, we'll discuss about activated partial thromboplastin time APTT and heparin therapy. So, what is activated partial thromboplastin time? APTT is a global coagulation assay. So, it is a global coagulation test. It measure time taken for blood clot. So this one used to measuring the time for clot. Clot is initiated by intrinsic and common coagulation pathway. This clotting is initiated by intrinsic and common coagulation pathway. So there are two type of pathway: coagulation or clot of blood initiated by two pathway, intrinsic pathway and common pathway. Both pathway activated clotting factor 10A. Both pathway, here intrinsic pathway also, this common pathway also, this one will activate that factor 10A. That 10A further activated prothrombin to thrombin. Then this thrombin will activate fibrinogen to fibrin. Finally, this fibrin form a fibrin mesh network which platelet and blood cells are entangled, which resulting in that formation of clot. So both pathway activate clotting factor 10A. 10A will activate prothrombin to thrombin. Thrombin will activate fibrinogen 1 to fibrin 1 1A. Then it involved in formation of clotting. Important to notice that activated partial thromboplastin time evaluate the integrity or functioning of clotting factors that involved in that intrinsic and in a common common coagulation pathway. Intrinsic pathway of coagulation pathway of blood initiated by initial injury to that wall of the blood vessels, and because of this internal injury to the wall of blood vessels, it is subendothelium that get ruptured. So subendothelium collagen is exposed as soon as clotting factor 12 comes under contact with the collagen. Then 12 is activated into 12A. Then this 12A further activated this 11 to 11A. This 11A further activate factor 9 to 9A, and clotting factor 9A complex with clot factor 8A, and this complex activate clotting factor 10 to 10A, and further the clotting factor 10A in the presence of clotting factor calcium and 5A activate prothrombin. Then prothrombin activate thrombin. Then fibrin, this thrombin will activate fibrinogen to fibrin, form a mesh or network that result in formation of blood clot. Here important to note, APTT evaluate that clotting factor 12, 11, 9, 8, 10, 5, 2 and 1. This is all the factors involved in intrinsic factor and factors involved in common pathways. Very commonly used powerful penetrated that anticoagulant is called heparin. So heparin. Heparin also initiate clotting factor 10A, then 2A, and heparin inhibit 9A, 2A, 12A, and by inhibiting these clotting factor, heparin induces anticoagulant effect. Excess dose of heparin. So excess dose of heparin causes bleeding and hemorrhage. SS dose of heparin causes bleeding and hemorrhage because this is very essential to monitor heparin dose on the regular basis. When the patient on heparin therapy and the heparin therapy is monitored by determination of that activated partial thromboplastin time, APTT. Let's study the method that is used for calculation or determination of APTT. Now first of all the samples of that patient should patient blood sample collected by the puncture of vein. So blood collected by puncture of vein. Blood is collected in a tube containing sodium citrate. The tube containing sodium citrate which precipitate calcium ion. So it will precipitate calcium ion and removing calcium ion from blood, and the blood become decalcify. Now plasmid separated from decalcified blood. So this is the test tube that show that citrated plasma. This is the decalcifying plasma. That citrated plasma show that yellow color. Now activator are added to that plasma. What are the activator? This kevolin and cephalin. Now the kevolin are activate the clotting factor 12, and cephalin substituted for that platelet phospholipid. Now activators activate clotting factor 12 and initiate that intrinsic pathway of coagulation. Calcium ion are required for coagulation. Citrated plasma has no calcium. So excess calcium chloride is added to the plasma. As soon as calcium chloride is added, so calcium chloride is added and already activator are there in the plasma. Intrinsic pathway of coagulation is initiated and the blood start coagulating, and APTT is the time calculated from that addition of calcium chloride for the formation of clot. Normal APTT range 30 to 40 second. That is normally intrinsic pathway of coagulation takes about 30 to 40 seconds for the blood clot. Now very important to note that administration of heparin anticoagulant will increases APTT because heparin inhibit clotting factor that involved that intrinsic pathway of coagulation and a common pathway of coagulation. Now, what are the clinical significance of APTT? This one APTT test is a direct monitoring therapy with unfractioned heparin. Then this APTT is used for detect that hemophilia by clotting A, B, C. That hemophilia caused by that A is caused by because of clotting factor 8, B is caused by because of clotting factor 9, C is caused by because of clotting factor 11. So this one clotting factor 8, this one clotting factor 9, this one clotting factor 11, this one is 8. Then this one used for coagulation inhibitor, this one increasing coagulation inhibitor, then increasing phospholipid antibodies. So these are the clinical significance. Normal reference value APTT, that means not on therapy, normal range, don't have any therapy, heparin 30 to 40 second. APTT is more than 100. Okay, so normal that when that patient taken heparin, that range 1.5 to 2.5 time is normal. So what is the range? 45 to 100. When normal is 30 to 40, when that patient taking heparin 45 to 100, when the range increasing more than 100 is high, there is risk for bleeding or hemorrhage. So therefore the dose of heparin should be closely monitored and reduced on the reduced. On the other hand, if that APTT of that patient heparin therapy is less than 45, that shows that effective anticoagulant effect is not obtained. So here this anticoagulant effect is not obtained against that patient. Closely monitor and a dose of heparin should be increased. So APTT is recommend to monitor that patient response to heparin therapy. So in this video discussed the activated partial thromboplastin time. So in this one is the global coagulation test. Two pathway, intrinsic pathway and extrinsic pathway. Activated method used for calculation of APTT. What are the clinical significance? What is the normal range without heparin? Then with heparin increases more than 100 means what is the risk? Decreases means what is the risk? Thanks for watching.